Hello, my name is Cameron Rochelle. I'm an occupational therapy assistant student at Nashville State. This week I had my level 1C fieldwork. We did a virtual fieldwork, and each day we saw a different setting and watched videos for each type of setting. I have some points to cover. That's what I'm looking at. The 2 days that I'm choosing to summarize are day 2 and day 3. Day 2, we saw a pediatric setting. We saw a patient, Molly. She was a little girl, and her diagnosis was a chromosome disorder. She struggled from poor lower body muscle tone. She struggled crossing the midline. Her muscle tone was very weak general throughout. She had max assist when she did the sit to stand. You saw the therapist. The dad came over and rubbed her legs and gave her some proprioceptive input, and this allowed her to be able to feel her legs more, and she was able to use mod assist to stand. She held herself a little bit better, but the therapist still was holding her up, and her dad stabilized her legs from the front. They also saw her laying on a mat and sitting on a mat. She tended to fall to the side. She had poor trunk mobility and couldn't hold herself up properly. She tended to hold herself up more with her upper body and to lean over on her hand. The therapist did sitting, took the quadruped position on all fours, and she struggled from holding her lower body up, so the therapist was max assist in the back. She did state that if she took her shoes off and her braces on her ankles, that it would make it easier for her legs to push up off the mat. So that could have been why she was struggling, but she was still mod to max assist on that. Her vision, she looked more in her peripheral vision. She struggled seeing things closer up. When she did hold her spoon, you could see she would look more to the side to see them. Her dad did state that she had problems with when her toys or her spoons was the same color tone as the floor or the mat she was on. She struggled differentiating where the spoons was or her toy. I think she will eventually need glasses, and that may be something that they can put into the treatment plan. They worked on crossing the midline and grabbing the spoons and her socks, and she struggled to use both hands. She wanted to use that same hand. Her grasp, she had the full palmer grasp when she grabbed things, so they could work on fine motor movement, pincer grasp. She will more than likely need OT when she gets into the school setting. Her father is very engaged in her occupation and her therapy session. I believe this will probably is one of the main psychosocial factors in this setting, because as long as her dad being so engaged and aware of her therapy and engaging, like him pressing on her legs for that proprioceptive input, he noticed in that therapy session before that helped improve her sit to stand, and he told the therapist, and it did improve it overall. So him being so engaged is going to help her improve her overall occupational performance and her play exploration. The day 3, Clint, we saw him in an acute care setting. He suffered from a CVA and his left side was affected. His left side sit higher up. It was swelled. He had limited range of motion. He could not grasp. He couldn't make a fist. His thumb he could do with the hitchhiker, but he could not bring it down. The OT suggested putting his hand down into ice water for 3 seconds twice. And after that, his edema went down in his hand. You could see his wrinkles start to return in his knuckles from the swelling reducing. He overall had increased range of motion. He was able to make a fist after that. The client was very engaged in the occupation. His main goals focused on he wanted to be able to open a jar. He wanted to be able to independently button his own pants and to wear shoes that he could tie, because at the session you saw he wore Velcro shoes. So he wanted to be able to pick his shoes and be able to tie. So the OT was going to teach him how to do a one-handed shoe knot, so he could pick what shoes he wanted. He stated that he had a caregiver, a friend at home that buttoned his pants, it tied his shoes when he wore them, and that was helping him manage his home. So he wanted to get back into his independent function. He stated that he had fell a month after returning home, and that he fell on his shoulder, so he had limited range of motion in that, and he couldn't reach behind him. His grasp was very weak. His overall arm was just overall decreased in performance. So they worked on him being able to tie his shoes with one hand. They worked on the tying a knot. They worked on they put his hand in the ice to reduce the swelling. This improved the range of motion. They went outside and they did a sweeping activity of a porch, and he demonstrated trying to sweep, and the OT demonstrated a better way to perform this activity, holding the left hand up higher and the right hand down lower to push. And when he changed his posture on the broom and his grasp, he was overall able to perform this activity more thoroughly, and he said that it felt better. He looked more, she said, normal pushing the broom. The overall personal culture and ability, I believe he came into the session positive. He was engaged in the activity. He wanted to be more independent. He was very engaged in each intervention that she took to help his independence, and this overall improved his performance. If he would have came in depressed and not wanting to learn, it would have affected his overall ability to recover. Him coming in with a positive attitude and him wanting to return home as quick as possible, this helped him progress faster. Like he said, his friend takes care of him, so that's more of his environment. He's going to be more in a home setting. He says that he goes for a walk daily, so he's engaged in the community and in social participation. Molly, her dad's going to be her biggest factor in this, that he is so engaged in the therapy setting that he is going to improve her overall occupational performance. He wants her to become better. He wants her to be more independent. He wants her to learn. And him noting little things into each therapy setting and relating them back at home, this will improve her overall occupational performance in play and play exploration, and her posture and her balance, how she stands. We was asked if we would feel confident today if we provided treatment with these two patients. I am more experienced in the PED setting. I have had my first level ones in PED settings. I have went and volunteered for PED settings more, so I'm more comfortable in that setting. My first level one I was in a school setting, so I feel confident that I could go into a setting with Molly and I could set up an intervention plan, a treatment plan, and follow it out to discharge. However, on a client in acute care working with a CVA victim, I have never worked firsthand with a CVA patient. I have worked on balance and endurance and range of motion with a client, so I'm confident I could probably come up with an intervention, but I would feel more comfortable if I had a clinician looking over me to perform a overall, from start to finish, an intervention plan with a CVA victim before I would want to go in first one-on-one with a client to treat them. So overall, both of the clients, I feel like their treatment sessions went very well. I feel like the OT worked very well one-on-one with them, and in the P settings, the OT worked very well with the client and her father. And in the acute care, I feel the OT did very well working on the biomechanic frame of reference and performing that, putting that into her intervention. She overall increased his range of motion, his endurance level, his balance, his grasp, his overall independence on ADLs and IADLs. I feel like the OT working with Molly, her performance of her engaging and crossing the midline and her sit stand and her sit quadruped, this is going to improve her overall independence of play and play exploration, and her engaging with the father is going to help him be able to relate that back into the home setting. When he goes home, he knows he can help warm her legs up when he's trying to make her stand up, or he can lay her on the floor in a prone position so she can explore, or when they are doing bath time, feeding, or dressing activities, he knows how to hold the sock over here so she crosses the midline with that arm, and he makes her cross the midline with both arms. Overall, this is all going to improve her play performance. This is all that I need to discuss. I feel like I learned a lot of it through this field work. I really do wish I had that hands-on experience, but the way we did the setup, I do believe that I fully learned everything that I was supposed to. During the PED setting, we got to sit down into the floor and demonstrate one-on-one on a doll how we would do a treatment session, and that helped give you that one kind of that hands-on experience. But our clinical instructors, they came on, they explained everything very well. They answered all questions thoroughly, and I feel like these ICE videos, they really gave a thorough first-hand experience of what an intervention setting looks like in each one of these settings. Each one showed everything that I feel I would see in that setting, so I feel like overall it actually was better because I got to see multiple different settings and see all of that. Even though it was through video, I got all of that different experience, whereas if I would have went on a field work and been hands-on, I would have just saw that one setting that whole week. So overall, I enjoyed my field work. I enjoyed these two settings the most out of those 5 days. I feel like these 2 days taught me the most, and their intervention plans was the most thought out, and you got to see those carried out throughout the 5 videos. Thank you.